Firstly, I like to use foam roller on the lats, which means get it just below the shoulder blade and run about 45 degrees on the side of the body. Okay, so we're just getting here and getting at the back of the arm. Gently stretch the arm, be careful it doesn't hurt. You can always hold the arm up here and get into the back of the shoulder. It doesn't need much, just like a minute, or run all the way down. Be careful here. When you start getting to the lower ribs, it will be a little bit tender with the kidney, and then get to the bottom of the spine, still running on the side. So we're running this side here, we're not on the side here, you're not on the back, because the lats run here all the way down here into the thoracolumbar fascia. So here at the back of it, you can see this big muscle here, and it's attached at the back of the arm. So we have to get underneath as well. It's just getting into the back of the arm here. Doesn't need much. A little bit more. And that's roughly it. Right, now we'll take the gym ball or chair and watch me. Make sure the elbow is not all the way over, because you can't go very far. Just have the elbow on the edge. The same leg on the same side with the arm moves back, and then we rotating the pelvis. So we want to get as much length from the attachment of the lats all the way down to the lower back. So what we're doing here, we are moving the hips away from the arm. You can take the arm across as well. That's even stretching it more. Don't force it. You don't want to feel any discomfort in the shoulder. So it's very gently, build up slowly. If it's too uncomfortable anywhere around the shoulder, just come up a little bit and see if you can create that stretch with the body, not going too far. Now then, come up a little bit, bend the arm, bring the hand on the back of the shoulder. I like to use the head to twist the arm and move the arm across. Well, that gives me length. That gives me really nice stretch. And then stretch forward. Look, I'm leaving my back knee down and I'm just stretching the elbow away from me. If you push the hand onto the back of the shoulder blade, you are getting even more stretch in the tricep. Remember, breathing is everything here. So deep breath in and out. Never hold the breath, because you're just sending a negative message to the brain. Good. And again, use the head to twist the arm gently, but always watch for the feeling in the shoulder. You don't want sharp pain, you don't want any discomfort. You don't actually want to feel anything much, because sometimes when you come out of these stretches, the discomfort can come afterwards. And then again, take the arm there, see if it allows you to go a little bit further. If not, don't force it and go to the next one, which is the pec minor. So the pec minor needs to have the arm to about 45 degrees. So I'm not right here, that's pec major. So I'm actually coming, put the ball right into the shoulder. Make sure you connect the shoulder with the ball. Grab the ball with the arm over and just slide back at about 45 degrees. Be careful here again, don't force it. Really hold the ball, hold it tight with your hand. Don't just rest the arm on it, hug it. If it's too much, just hold the ball and feel the stretch. Move around. Shoulder back, never shrug the shoulder, always rotating the shoulder back. Couple more breaths. And then you will go into the pec major. So hug the ball again, connect the shoulder with the ball. Make sure you're not holding the arm on it, but connecting the shoulder with it. Grab the shoulder, arm goes out to the side, never back here. Arm goes out, grab the ball and then slide sideways. Make sure the shoulder's not shrugging. Hold the shoulder back. Now if you look at it from the front, shoulders not forward, shoulders rotated back. Ball is connected. So I'll lay on it with my shoulder, grab the ball, and then slide sideways. Good. And when you get a little stretch, then start extending the arm slowly, fully, rotating the arm back, turning the head away, spreading the fingers, stretching the palm back, and then gentle side movements. Good. Just a couple more breaths. And then you can now test it. You can test for the lats. See if it allows you to go a little bit further, because when the pec minor is tight, sometimes it doesn't allow you to go very far. If it doesn't, don't worry, don't force it. Keep the thumb pointing upwards. And try to think about bending the arm over the ball rather than just resting it on it. So be active, get a nice stretch, and just bounce there. In this case, you let the shoulder come up towards the ear. So don't hold it back, because you're restricting the range. So you want to move the shoulder as far close to the ear as possible. Again, maybe move the hips slightly, maybe take the arm across a little bit. So I like to use my left hand to push the spine in the opposite direction, because using the left shoulder blade, engaging the shoulder blade and pushing it across to the other side. Again, stretch the arm. This can take only like 2 to 3 minutes, but it's a good preparation for the exercises that come. Right, put the ball on the side. Now, releasing tension from the traps. So let's say we're working around the shoulder and the neck is tight on this side. So what you do, you can sit on the chair, take hold of the chair underneath your bum with your left hand. Rotate the shoulder back. Completely fix that shoulder. Take the head. And very gently, just pull. Very gently. Pull and pushing the left shoulder down. When you start feeling stretch here, then push the head back into your hand. Like you want to bring it back there, but you're resisting that movement with your hand. Keep pushing the head back. Count of about 5, 7. Take a deep breath in. And with the exhale, gently pull the head again. And hold it there for count of about 8. Hold it there. Make sure the head is not tilting too far back, but the head is actually slightly down. One more breath. Again, push the head back into your hand. Keep pushing. Big breath in. Exhale. Pull it a little bit further. So it's 8 on, 8 off. So we 8 seconds push into the hand. Big breath in, exhale, pull, hold for 8. Repeat that 3 times. When you get to the range of the movement, roughly, however far you get, then hold it down after the exhale for a count of 20 to 30. It's like 20, 30 seconds. And then you release it. Only stretch the side that is tight, which means if I got tight lats, if I got tight pec major and minor here, I'll stretch that. If I got tight traps here, I stretch that. And if I got tightness anywhere around the rib cage, so let's say I'm twisted here, that means, you know, I'm tight here or there, or I'm twisted this way. So let's say I'm tight on this side. Then I will take the roller, lay on the roller, and look where the tip of the roller is. That's exactly where you're stretching. So if you have it down here, you'll be stretching here, but we want to get into the ribs here. So I'll lay on it. Nice and square pelvis. Move the bottom hip away from you. So we want to lengthen this side. We want to shorten this bit here. See, I don't want to be this way. I want to move that bottom hip away from it. This is long and I'm stretching this. And then either just rest the arm somewhere. You can always use the ball if it's too intensive. Or chair or even sofa if you're close to sofa. And then just go to a little twist and just breathe here. This is all about breathing. The stretching is all about one thing, and that's how deep can you actually inhale. Never hold the breath here. So now we're getting down here. Yes, we're stretching the lats as well a little bit, but we're getting into these tight muscles here around the rib cage. A few more breaths. And then release. And then we will go into the physical work, into the exercises. So now we remove the resistance from these muscles. So my shoulder is protracted. So I remove the resistance, and now I would go into the exercises. Actually, before I go there, I actually can get a ball here and get into the pec minor. If that's very restricted, then use the pec minor. There's an option here. You can either do it on the wall, or you can do it on a stool, where you can take the ball there with the arm on it. So never do it on the floor, because you won't really get there. Because if the shoulder is protracted, you won't get there. So I would put that onto a little stool or something, and then get onto the point, onto the spot that is very tender. Find the spot, and all you do then, very gently move the arm. You don't have to force it up, just move around that spot. Move slightly with the ball, find another spot, and move. This could also be done if there is any discomfort in the shoulder, and it can be done on the days that you're actually resting. All these stretches are important. If the muscles are tight, I'd remove the resistance first, so all the exercises are much more effective. And then just find these little spots, moving the arm. They will be very tender. So if you go hard ball, maybe put some sock on it or wrap it into towel, and just gently going around and moving the arm up and down. Get closer to the breastbone and run the muscle up and down. So how are we moving here? Basically, we're moving here firstly in this little dip. Get in there, right below the collarbone. That's where the pec minor starts. The pec minor runs down and runs in 3 different heads of the muscle. So run it across here. And then when you get close to the sternum, the breastbone here, the pec fibers run this way. So we want to run the ball up and down this way. This is how they will get stretched. If it's very tender, sometimes even this is enough. Find the spot and then very gently move the arm. That's a possibility too. And that's kind of enough. And then we would go into the strengthening exercises. I like to attach the band to like a radiator or some weight like a kettlebell. Take the arm to 90 degrees, not here, out here, and have the elbow open to 90 degrees as well here, not close, not too far out. We open the arm, go down only as far as it allows you, because if there is any impingement in the shoulder, this movement can cause a little discomfort. And then pulling it back. As you're pulling it back, make sure you tuck the shoulder under. Or firstly, tuck the shoulder under, take the elbow out, 90 degree in the elbow, 90 degree to the body, 90 degree with the elbow. And then slowly, with control, only pulling as far back as it allows you. Don't force it. I would rather stop 10% before the maximum range, because we don't really want to hit that. It might not hurt you as you're doing it. A few hours later, you think, oh, I've irritated something, which is fine. It will calm down, but the shoulder needs to be trained. So again, right, bring it down and slowly pull it back. After every repetition, adjust the elbow, because it will probably have tendency to slide back. And again, shoulder needs to be corrected as well. So we don't want to have the shoulder up here and arm here. We don't want to do it this way. Yeah, we want to have the shoulder tucked under, elbow high, and very slowly. That's one way. I like to go to failure here, but something like 20-25 repetitions would be sufficient to start with. Maybe 1 to 2 sets. you'll see the elbow will have tendency to slide back. So make sure you're not doing it here, because what happens then, the shoulder is actually being torqued. We don't want that. So we want to be here and only go as far back. It's better to do 5 really precise movements than trying to do 25 with poor form. Yeah, so, and that's how I would basically go to complete failure. Then the next one is the arm goes up, okay? Be very careful, see how far you can get with the range, and again, don't force it. I like to lift up, press the shoulder blade down, and then slide up slightly. So that I know the skin is holding my shoulder blade down, and then we go in this way. Look where my arm is. It's not here, it's not out here. It's going into nice angle, yeah? So we've got 90 degree here. Bring the arm down and up. Once you have more range without any discomfort, and you'll only know about the discomfort next day or day after. So if it doesn't irritate the shoulder much, what you do, you start slowly, just a little bit lifting the arm. We don't want to be all the way here, we don't want to be all the way down, but you might have to start this way and slowly build up until your upper arm gets to about 45 degrees. And again here, the ideal number would be around 20 to 25. But if you feel you're okay and you build up after a few weeks, just go to failure. So my number would be about 100. And once I get to high number, like 100, then I add resistance, and I start increasing the resistance and building that number to 100 again. Okay, so option here as well is a towel is good, right? Use some fabric, maybe a little towel, kitchen towel or something, and squeeze the elbow there. Make sure the elbow is not out here, but it's actually sitting in front of you a little bit, and then external rotator. Hold the elbow, hold it close to the body. So make sure the arm is not coming away, because then we will be involving the deltoids too much. And again, all the way here, very slowly. Make sure you're not overturning the wrist. So keep the wrist slightly back here. If you take the thumb on top of the handle, you probably get a little bit bigger range. Just a little bit, because if you grab it under, it's a little bit restricting. And the same here again, I would go to about 15 to 20. So the resistance, set up your resistance that you able to do about 20 to 25 comfortably on the first set. You just struggling on the second set to get to 20 to 25. On the third one, you are on fire. And if it's too much, just do it that way on the first set and build up slowly again. See how you feel next day and day after, and very slowly build up that way. Okay, and that's basically how you get through these exercises. And I think these 3 are sufficient for about 4 weeks. If you don't see a result in about 1 week to 10 days, you have to work on the form. Right, no pain here. What we want to do here is not to irritate the inflammation there, okay? So stay before the pain. If you feel any discomfort and you're thinking no pain, no gain, you've gone too far, you've been counterproductive. No pain. See how you feel after and next day. If you feel, okay, I'm good, either at more reps or sets or at resistance. And again, always look for how you feel the day after or 2 days. Have a little break in between for the first 1 or 2 weeks, and then start adding more training daily as you start improving, okay? And you can test how you feel when you lay on the floor. So you lay on the floor, you take the arms there and see how you feel, okay? You can always lift the arms up and down and up and down. So if the arms are about here, there's no need to push the hands down. You're not getting anything here. right? So basically just slide it up and down and you will work on your external rotation. But if the hands are on the floor, start moving up, bring them up here, press them into the floor, hold them a little bit, tuck in the tailbone under, and then bring them down again. So we go up, 1, 2, hold and count of 6, 1, 2 down, and again, up, hold it 6, 1, 2 down. I'd repeat that about 12 to 15 times. If it's irritating the shoulder, don't push too hard. Again, hold it like that, pressing the spine down, and release. Now, if your arms don't get to the floor and they are here, you can always lift the buttocks slightly up if you can get them there, and do it this way, because you want to activate the rhomboids and the muscles around the shoulder blade. Because if you are down here, you're not getting the hands on the floor, you're not really pushing into the external rotation as much. So if you lift the buttocks, that will allow you to get the hands a little bit further up. And then you move up and down. You can do this standing up against the wall as well, which sometimes is harder, but I find it more effective to start with if you've never done it before on the floor with the buttock lifted. Sorry, 1, 2 up. No need to go too high. Don't go too low. Just above the head. Pushing it down, rotating the shoulder back. Make sure you're not shrugging the shoulders. Okay? And again, 1, 2 up. Hold for 6, pushing the spine down. And 1, 2 down. Test the shoulder. See how you feel. If it's not sore, a few hours later or next day, you're good. I would keep it like that for a week, and after a week I would start adding a little resistance or another set or a few more reps and building up that endurance. So firstly, work on endurance. There's no need adding too much weight, because we need to be able to do at least 50 repetitions with that weight. So built up from about 20, 25. Every other workout you can add few more reps until you get to the number of 50 on one rep. Then you can do a few reps. When you can do 2 to 3 sets of 50, then start doing 1 set to 100. Once you reach 1 set to 100, add weight or resistance. Okay? And I hope this helps. Let me know how you're finding it. Any questions, just drop me a line and we'll go over it.